Hi, this is Professor Anil Arora. I am Vice Chairman and Head of Department of Orthopaedics and Joint Replacement, Max Hospital, Patparganj. We all know robotics are coming in a big way in our lives, in every sphere of life. And knee replacement or hip replacement are not untouched with robots. For last few years, we are gaining more accuracy, more predictability by using these robots. I've been using Cubis robot for almost last 2 years. It has undoubtedly changed and transformed the lives of my patients. Now, there is no guesswork. We have objectification of everything we do on table. What is the amount of bone we are cutting? How much are we replacing? What is the soft tissue tension? What is the size of implant we are going to put? Where it will be placed? What result we are anticipating? It is very, very clear before we actually do the surgery. So it is quite innovative and very, very helpful. Now, objectification of our thought process, our feel can be now transferred to our juniors. Earlier a senior would say, okay, see, this is good, this is bad. But now we can objectify and see what is good, what is bad, and what has transformed into good clinical result. So these objective numbers, personalized knee replacement is going to help our patients immensely. Talking about the new innovative MISO system, I should congratulate Merrill for bringing out the so-called within reach of an orthopedic surgeon MISO system. It is further improved system on QVIS. It is smaller in size, easier to manage, and better software. So I have no doubt that MISO system in next few years is going to change the scenario of robotic knee replacements, robotic hip replacement in the country. India is taking lead in innovation, and this is indigenously developed system. For any further enhancement, we don't have to depend on any other country. You have software available, hardware available in your own country. So undoubtedly, we earlier used to have robots only in metropolitan cities. Then it went to Tier B cities, and I'm sure every district in next 5 years is going to harbor a robot and give beautiful results of knee replacement. Now, what is the way to promote any good surgery? That is result. Robotic knee surgery in the past few years has given very successful results. And now patients are coming and asking for robotic surgery. Gone are those days when patients used to doubt knee replacement. Now things have changed. Patients come and ask you, sir, can you do robotic knee replacement for me? So bringing indigenously developed MISO system, I'm sure will further drop down the prices of robotic knee replacement. It will become within the reach of a common man to get benefit of this innovative, highly skilled surgery. And I'm sure it's going to change the scenario of knee replacement. I wish all the best to Merrill, to this new MISO system, and I hope a common man derives benefit of this immensely beneficial surgery. Thank you very much.